So this GP is happy to do video consultations, but by the time they arrange it and do the test, it takes more than 15 minutes, sometimes 25. Do you have any tips on how to cut these times down?
Yeah, so I have to say, I find that my practice is to give the patients as much time as they need, and it does mean overrunning sometimes. But I just think what I would gain in terms of efficiency, I would lose in terms of the patient's confidence. And so I tend to just give them as much time as they need. And sometimes with a complex patient or a patient who has many problems, that can be really tricky. I suppose the one thing I would say is that there are some patients who want to talk about other things, and there isn't really a lot of time for that. We have a bit of chat for a couple of minutes, but after that, it's really important to focus on what's important. And so really useful phrases I find are, let us talk about your knee. Your knee is the important matter here. We need to focus on that now. And you can remind patients of time as well. You can say, we have just another 5 minutes, so I really need you to show me what is going to be helpful, and then explain the test. And so one thing that I've heard colleagues do sometimes, just to demonstrate on themselves, they will put their own video cam directed to themselves and stand up to demonstrate what they want to do in terms of bending the knee. I have to say I haven't had to resort to that. I find patients, if you're patient with them and allow them to do it in a way they feel is comfortable, it does take a little longer, but they usually get there just by directing them verbally. So I guess another tip is to practice those phrases. Can you bend the knee? Can you take the knee into the chest? Put your hands on the front of the leg, so you can direct them really clearly, and just be patient. That would be my tip.